First trimester, week 1 to 13. Week 1, the first week is actually your menstruation period because your expected delivery is calculated from the first days of your last period. This week counts as part of 14-week pregnancy even though your baby hasn't been conceived yet. Week 2, the sex of baby is determined at fertilization with X or Y chromosome from the sperm. Ovulation around the midpoint of the menstruation cycle is the prime time of conception when a sperm fertilizes an egg leading to pregnancy. So week 2, preparation and ovulation of egg. The ovulation days 14 and week 2. Within 24 hours of ovulation, the egg is fertilized by a sperm. If you have had sex in the last few days within using contraception, fertilizing, joining of egg and a sperm. Week 2. Week 3. After fertilization, a zygote is formed. The zygote moves towards the uterus. As it moves toward the uterus, its divided, grow and changes into a ball of cells. Week 3. About 5 to 6 days after ovulation, the fertilized egg burrow into the lining of womb. This is called implantation. Week 3. Week 4. At 4 week of pregnancy, the embryo develops the amnion and yolk sac implants in the uterus and begins producing HCG, signaling the start of pregnancy and the end of monthly. Size 0.2 mm, heart rate no, weight not. Week 4 and week 5. During this stage, the embryo takes on distinct shape with the formation of the neural tube and heart development, while the placental provides nourishment. Size 1 to 2 mm, heart rate 80 to 85 bpm, 80 to 85 bpm. Weight no. Week 6. By week 6 pregnancy, the baby's brain, heart, eyes and limbs start developing. Expect common pregnancy discomfort like fatigue, breast tenderness, morning sickness and increased urination. Size 2.4, heart rate 100 to 115 ppm, weight 0.19 gram. Week 7. By this week, the baby's lifeline, the umbilical cord, has formed, providing nourishment and oxygen. The baby's face is shaping up and mucus plugs saying the cervix to protect the uterus during pregnancy. Size 5 to 9 mm, heart rate. Week 8. In the week of pregnancy, the baby's tiny finger and toes are forming and their eyes develop pigment. Intestines protrude into the umbilical cord. Size 1 to 5 or heart rate 150. Week 9. At this stage, your baby's tail is shrinking while the head is growing. The baby measures about 0.6 to 0.7 inches with developing features like the nose and eyelids, and the digestive system is progressing. Size 2.3 or week 10. At 10 weeks of pregnancy, your baby's vital organs have formed and it's no longer an embryo. Your first parental visit includes test, checkups and heartbeat check along with blood test to screen for disease and genetic issue. Week 11. During weeks 11 to 20, the babies grow rapidly with facial development and the differentiation of genitals occurring. Recommended weight gain in 25 to 35 pounds and first trimester scanning tests are offered to access chromosomal abnormalities. Week 11. In week 11 and week 12. In the last week of the first trimester, the baby's brain, vocal cords and kidney develop while the skin appears more radiant due to increased blood volume and hormonal changes, potentially causing temporary acne. Second trimester, week 13 to 27. Week 13, after weeks pregnant, the baby's genitals forming and the mother might experience relief from morning sickness as the womb grows. A small bump appear and any discomfort while urinating should be addressed promptly to avoid. Week 14, your baby is growing long hair and has fully developed genital. You may discuss amniocentesis with your healthcare provider if you are over 35. If there are week 15, by 15 your baby can start hearing soft sound and might sense light. And at 15 weeks, your baby's skin is soft and translucent with visible blood vessels. Escalation and muscle development lead to various movement, and you might be realizing your pregnancy with mixed emotion and occasional furtherance to hormones. Week 16, a week of pregnancy, a second trimester screening test measure levels of alpha fetoproteins, HCG, sterile, and sometimes inhibin A to access the risk of neural tubes of defects and chromosome abnormalities. Week 17, your teeny baby is almost 5 inches in length with a growing placenta, facilitating nutrient exchange. Hormones are enlarging breast for milk production, increasing size and visibility, prompting the need for supportive birth during pregnancy. Week 18, in this stage of pregnancy, your baby's ears and eyes are developing with the ability to hear and detect light. Additionally, consider finding a pediatrician asking essential questions to ensure the right health care. Week 19, at week 19 of pregnancy, your baby is covered in vernix sesiosa for skin protection and developing brown fat for warmth. You may start feeling your baby's movement known as quickening. Week 20, at 20 weeks of pregnancy, your baby weight 11 ounces and about 6.1 inches in long. As your baby grows, it may put pressure on your organs. The ultrasound can determine size and sex. Check for week 21. Amniotic fluid aids baby's digestion in late pregnancy, while most nourishment still comes from the placenta. Safe pregnancy exercise should be low impact like yoga, swimming, and walking after consulting healthcare provider. Week 22. At these stages, your baby senses and developing, allowing them to feel, touch, and potentially experiment with men while their reproductive system is progressing, and you might experience Hicks contraction. Week 23. At this stage, your baby is growing weight and moving actively. Preterm birth is risky but manageable with expert care, and sleep can be challenging, so consider side sleeping for better blood flow to the placenta. Week 24. The baby innards responsible for balance is fully developed, enabling them to sense their orientation in the amniotic fluid. Additionally, during this times, week 25, you notice your baby resting and alert period, and they are developing hearing. However, digestive discomforts like reflux due to hormonal changes and uterine pressure. Week 26, your baby's eyes are beginning to open and their color might vary. They weigh around 2 pounds and are still wrinkly, steadily gaining weight for your body. It's time. Week 27. Appearance resemble that birth with vital organs still. It's a good time for expectant parents to attend childbirth classes for information on labor. Third trimester, week 18 to 14. Baby weight around 2 pound, brain development continue and fat layers are forming. The baby's position, whether head first or breech, can change with the next 2 months, and RH factor tests are conducted. Week 29. Monitor baby's movement at least 10 kicks in 2 hours and discuss reduced activity with your healthcare providers. Also maintain 30 mg of daily iron intake. Week 13, the baby weight around 3 pounds, develops fat layers for warmth, practice breathing movement, and may experience hiccups. Constipation is common due to solid digestion. Combat it with exercise. Week 31, your baby is urinating into the amniotic fluid, which is essential for their growth. Monitoring amniotic fluid levels in ultrasounds help ensure your baby well-being. You might also notice. Week 32, pregnancy. Your baby is almost ready to born and would be okay if you born early. Watch our for signs of problem called preeclampsia, like high blood pressure, and tell doctors. Week 33, brain is developing and they can sense their surrounding. Their lungs are nearly mature and they are gaining weight for protection. You are approaching childbirth, so learn about pain management option. Week 34, pregnancy. Maternal calcium intake is vital for baby's bone development, and babies are usually positioned for delivery. Fatigue is common due to various factors, so rest and nap are recommended. Week 35, your baby is rapidly gaining weight, depositing fat, and becoming more compact in the womb. Your baby strangers fostering a sense of security and affection. Week 36, the baby is gaining weight with a plumber face and skull modeling for birth. You may have more frequent checkups, potential cervical changes, and a return of appetites. The baby drops into the pelvis. Week 37, the baby has developed coordination to grapes and may react to bright light. They are gaining weight rapidly, with boys generally weighing more or birth. Expect the possibility of losing the muscus plug. Week 38, weight around 6 pound and measured about 9.4 inches. Gender specific developments like testicles drop, labia development occurs, and decision about circumcision may need discussion. Weight 39, the umbilical cord is typically 22 inches long and might occasionally wrap around the baby's neck, potentially requiring a C-section. The baby's skin lodges vernix and longio while your body contains. Week 14, expect your baby to weigh around 7 pound. Birth can happen soon, but due date can be off by up to 2 weeks after birth. Your baby may have temporary physical